Hi, I'm Jaron Riley. I'm a pediatric orthopedic surgeon here in Denver, Colorado, and I specialize in pediatric spine surgery, specifically in the treatment of scoliosis. One of the things that we are pioneering here in Denver, Colorado is the use of a device called vertebral body tethering, which we hope leads to a solution for young people with scoliosis where we can not only straighten their spine, but also keep the spine as flexible as possible and have the spine be as healthy and lifelong durable as possible. Informed consent is a huge deal. Basically, what informed consent means is that when I meet with a patient and their family, we have to talk about, are you a good candidate for surgery? Do you really need surgery? Are we going to be able to help you through life with your scoliosis with bracing or with physical therapy? And can we stay away from surgery entirely? So we really need to understand, is surgery necessary in the first place? Then once the patient decides, yes, we need to move forward with surgery, then we have to make additional decisions. We have to figure out, are we looking at more of a fusion type surgery? Could we be a candidate for vertebral body tethering? There are risks and benefits to any surgery, but when you're talking about the differences between those two in particular, you really get down into some very fine details. Details like, what's the approach we're going to use for surgery? What's the recovery like? When can I get back to sports? Will this allow me to do the things I want it to do? And very importantly, what's the data that tells me my outcome will be as good as possible? For example, with vertebral body tethering, we have really pretty good data that shows us how this surgery performs for about 2 to 4 years after surgery. It performs very well. It's really good at getting the curve straight. It absolutely will maintain flexibility, but we don't have any long-term data. In other words, we don't have any 13-year-olds who are now 50 years old to tell us, will this last over a lifetime the way that we want it to? So whenever a patient is really interested and they are a good candidate for the surgery and they want to move forward, I'm just really careful to tell them, you're kind of like the first person on the moon or the first people going to Mars. We don't know how this is all going to turn out. We think it's a really good idea and the early data is very promising. But it's a journey that we step into together, and we both have to be able to follow this over years and decades to see how it's all going to turn out. So of any of the surgeries I do, informed consent for vertebral body tethering is a huge deal because we have to be able to discuss the likelihood, the idea that we actually don't know how this is going to play out over a lifetime. And that's something we have to be committed to follow up forever so that we know how that's all going to come out.